Interestingly, research has shown that there are differences in interoception in autistics than in non-autistics, just like there are differences in the mirror neuron system between autistics and non-autistics. A study by Mole and her colleagues demonstrated that autistics have less interoceptive sensitivity and less interoceptive awareness than non-autistics. Interoceptive sensitivity is the ability of an individual to accurately perceive what their body is experiencing, and interoceptive awareness is the ability of an individual to really think about it and understand that it is happening inside their own body from a metacognitive perspective. Interoception, like exteroception, is a sensory process. And we are often talking about sensory differences in autistics in comparison to non-autistics. Yet, in general, the kind of sensory differences that we're talking about are exteroceptive sensory differences, not interoceptive sensory differences. We talk about autistics having either hyper or hyposensory experiences. Sometimes they are sensory seeking, maybe sniffing different objects or staring at something that's moving or begging for that extra screen time. Sometimes they are sensory avoiding, escaping everyday sounds, sights, or textures. And sometimes they do a lot of stimming, repetitive behaviors of pacing, foot tapping, or rocking. And this focus on the exteroceptive differences in autistics' sensory processing has really taken our attention away from the interoceptive differences. And it is potentially these interoceptive differences that play a role in the difference between autistic emotion sharing empathy and non autistic body empathy. And that is therefore playing a role in many of the communication difficulties that are going on between autistics and non-autistics inside neurodiverse family systems. So please remember in the future when you're making observations about the different sensory experiences between autistics and non-autistics to remember that autistics and non-autistics are also experiencing differences in interoceptive sensory processing, and that many autistics will state that they don't have much of a sensitivity or awareness of interoceptive perception at all.